legacy of the new department, we too will be able to identify those people that we believe are the appropriate persons for the leadership positions, and certainly work towards creating an environment and an organization that will let them have long longevity in the positions that they have as they go forward in providing leadership in youth operations.
Mr. Secretary, can you talk about what is now going to be in place that will allow the department not to come in over budget every year, which you've done the last 5 years, including this fiscal year that just ended? What systems are in place, or what changes are going to be made so that taxpayers aren't continually asked to keep funding more and more?
I think the one key component that has been established in the new organization is that we have aligned both the budget responsibility and the program responsibility, and we created a system in the event there's a necessity for an operational change, we will go forward and identify that as a necessity for a budget change. And now that we've gotten an organization that we can make good, solid, comprehensive decisions on across the board, as opposed to those decisions that what I would define as being somewhat stovepiped or parochial in the past. We have one budget, we have one budget officer, we have one budget shop. We can make conscientious decisions of where we're going to fund programs at, and if we make program changes, we can now augment that funding appropriately. So I don't see anything going forward in regards to deficiency if they are not in the area of population changes where we have to get funded for the population that we receive. Yes, sir. I think that in California, the no smoking policy at prisons has been well documented in other prisons that have already gone forward with that. I don't anticipate that to be problematic. I think the staff in the field have done a good job in preparing the institutions and the population for the implementation of the new law today. We haven't found that to be overly problematic in the past and where those implementations have gone forward, and I don't anticipate them to be problematic now. I think that the evidence that was presented to him was accurate evidence. I think that the challenges that have been presented to us were clearly articulated as the accurate challenges that reflect what's going on in regards to the provision of health care in California and the prison system. So it's fairly accurate. I'm not going to get into a debate with Judge Henderson on whether or not he's depicted things wrong or right. You know, I've had conversations with him in the past, and I'm very clear that he has lifetime tenure, and my preference is to work collaboratively with the federal court and get the system fixed.